Good afternoon. Thank you so much for joining the mayor and the Minority Caucus in a partnership to speak to you all in response to the revelation that minorities are disproportionately impacted with health disparities and particularly COVID-19. We have a great group of panelists who will discuss various topics of coronavirus, from operating within to the dispense of state and federal funding. I want you all to know that you can go and ask questions in the chat box, which will be answered at the end of each of the session. I am pleased and so happy to present Dr. Michael Caldwell, who's going to give the nuts and bolts of operating in the age of coronavirus. He is the director of the Metro Public Health Department. Next, after him, we will have COVID-19 disparate health implications for minority communities. And Dr. James Hildreth is our speaker, who is the president of Meharry Medical College. Following him will be Dr. Deanne Bullock, Staying Safe. She is the chief medical officer of Metro General Hospital, our community hospital. We also have from Metro General Hospital is Dorothy Bennett. She's chief of ambulatory services, and she's been working alongside MDHA, and she's going to give updates on those screenings. Dr. Alicia Hall, a family medicine practitioner who also works with the Ascension St. Thomas, also a volunteer working with MDHA, will be sharing her expenses of the screening and testing done during that time. And finally, we will have Representative Reverend Dr. Harold Love, who represents the 58th District of the State of Tennessee's General Assembly, who will discuss state and federal funding. Please welcome the panelists as they come, beginning with Dr. Michael Caldwell.
Thank you, Councilmember Hurt. You're really a great partner. I was so pleased to meet Councilmember Hurt as I was thinking of applying to be the Director of Public Health. I made it my mission for the weeks and months before I started to try to get to know the community as best as I could. And one of the things that I did in particular was to recognize the importance of the Minority Caucus of Metro government to being an important place where people come to share ideas, concerns, and to bring all of the community together to focus on the issues of the marginalized, of those who have struggled so much in our community, especially the African American community and all of the other new members in our community who have such a difficult time. I want you to know that this COVID crisis has been one that has impacted all of us, but especially those who are in the communities who seem to always carry the greater burden. We are seeing specifically that the death rate of COVID, we've been blessed in some small way that our death rate has only been about 1%. Here in Nashville. But yet, of course, as again, the African-American burden of that, numbers of 51, has been too high. Out of the number of African-Americans who have died, there are 20 African-Americans have died out of those 51. Out of the numbers that we have of tested African-Americans who are tested, 584. So even our overall death rate is about 1%, still not good. In the African American community, it's nearly 3.5%, over triple what we're seeing in the white community. This is just one example of the disparities that we're seeing. I do know another problem that we have is trying to continue to assure the trust between the public health community and the African American and other marginalized communities typically. We have made great strides in partnering with Meharry and Nashville General to have one of our assessment center sites right there. And now it's operational every day from 9 a.m. to 3 p.m. Our hotline is available 7 days a week from 7 a.m. to 7 p.m. You can find that number on the Hub Nashville on your smartphone or the covid19.nashville.gov website. I'm really pleased to let you know there's been a transition now, and we've contracted with Meharry and Nashville General to staff all of the assessment sites, the ones at Nissan Stadium, the one continuing at Meharry Medical College, and also the one at Kmart in Murfreesboro Road, the old Kmart. We want everyone to understand that when they go to an assessment site to get tested, the test is free. And we want everyone to know that this information that we provide you is not just to get you tested, but to help protect you. Because we are seeing the disease spread not only at employer sites, but within the home and within the community. And what we treasure usually as large family gatherings, times to socialize, to get together, spend lots of time together, that puts us at the greatest risk of transmission of this disease. I know Dr. Hildreth will be joining us after, and he spoke at the mayor's press conference today and reminded us that it was an event in Albany, Georgia, a funeral where people were coming together, where there was just an explosion of this transmission of COVID. So we want to attack this disease throughout the community, but specifically in the African American community, the Hispanic community, and other diverse cultures in a way where we can provide as much free testing as we can to as many people as we can, and that we are going to continue to expand our contact tracing. Our number of staff have expanded from 4 to now over 100. We have partnerships not only with Meharry Medical College, but also with Siloam, that is helping us with their community health outreach workers to be able to provide many language connections and culture connections, especially to what we're seeing in the last heat map that we had displayed, where we're seeing a lot of disease in the southeast part of our community. We know that getting this disease transmitted at the work site is a problem, or at some other type of event. So out of all the cases we're seeing, about a third are connected to some cluster, some event, some work site, some gathering. The other third we see is spread at home. So people do bring this home and they share it at home. So we want to teach you how to be able to be safe at home and in your community. And the other third of cases are somewhat random or interconnected. But the two most important places we're seeing are those essential workers at the work site, in their communities, and at home. Today was a really important day because Mayor Cooper has announced that we're making slow progress in fighting this virus in our community. We're moving from phase 1 to phase 2, and that will be effective this coming Monday. But this is not a time for us to celebrate. It's a time for us to feel that we've made some progress, but now more than ever, we have to double down on our recognition that this virus is dangerous, it's deadly, and we have to live with it. We have to respect it. We have to respect each other. And I'd like to remind you that when I wear a mask, it's not because I am scared of you or fear you. By me wearing a mask, I'm showing respect for you, because By me wearing a mask, it's protecting you from my breath, from my germs. We're seeing more and more recognition that this virus can be in asymptomatic people. So we must treat everyone that they could have COVID and that we might have COVID. So the more that we can get people to wear masks as much as possible, especially employees, which is required, as much as we can continue our social distancing, as much as we can continue our outreach into the communities to assure that people are educated and doing everything they can do, as long as we can continue to assure that everyone who wants a test can get a test to protect our vulnerable populations. And I couldn't be pleased more than to have a partner like Councilmember Hurt, who reached out to me early on in this outbreak, said, Dr. Caldwell, I want to help you do extra outreach to the minority community. And I welcomed that. I was so grateful. And she continues to do that, working with the Metro Department of Housing in a pilot program initially with family practitioner Dr. Alicia Hall, who's also going to join us today. How grateful we are to have Council Member Hurt and all of you in the community who are partnering together. You're not in this alone. I am your partner. We are together, and we are going to continue to address issues, to continue conversations, and to make sure that everyone has the resources they need. In addition to what Meharry is doing, helping us out with these assessment sites, they're helping us lead what we're calling strike force teams. If we need to very quickly go into a certain environment, whether it be a homeless shelter or a jail or a nursing home or certain neighborhoods that may not have access to testing, we are working together with all our partners to provide this mobile testing efforts, and there are going to be more and more of these. We need it now more than ever. We have to, as people are starting to walk around more in the community, we need to know this virus, and as Mayor Cooper said, to unblind us, to make the virus visible so that we know where it is, we can attack it, we can isolate it, we can contain it, and we can stay safe, and we can reduce the death rate in our community. So while we have done a lot in such a little time, and there's been a lot of suffering, not just from the virus, but from what we've needed to do to protect ourselves from the virus, our challenge continues. The work, in some ways, has been successful, but in some ways the work has just begun. And a lot of what we're doing now in building our partnerships, these are going to be long-standing partnerships. I promise you, we are not just building a COVID response, and then when we get rid of COVID, we're going to forget about all of the continued problems that we have, the infrastructure, the reasons why the African American community is dying at a rate unacceptable and 3 times higher than the white community. We will not forget that. We will continue to address all of these issues together, and I need your help. One of the people who are here to help and has been a great partner day in and day out at many of the Mayor's Press events has been Dr. James Hildreth, the president of Meharry Medical College. And I'm very pleased to introduce him now. Dr. Hildreth?
Thank you, Dr. Caldwell. And thank you, Councilwoman Hurt, for your leadership. Let me say that Nashville is extraordinarily blessed to have the leadership we do have. The mayor, Dr. Jahanger, Dr. Caldwell have all done a great job of helping us navigate through this very challenging time. I'd like to speak to the underlying causes of African Americans dying at a much higher rate than whites are dying. And of course, this is a national challenge, not just a challenge here in Nashville. We understood early on when the pandemic began that if you were a person with certain underlying conditions, including hypertension, heart disease, diabetes, obesity, if you smoked, that the virus was very likely to cause a much more severe disease in those individuals. And of course, it's well understood that here in the United States, Nashville not being an exception, that African Americans, our minority communities overall, have a much higher burden of those conditions, and that's why we have to consider those a vulnerable population. But as you heard from Dr. Caldwell, the fatality rate for African Americans in Nashville is considerably less than it is in other cities like Chicago and New Orleans and New York and places like that. And in part, that's due to the strong leadership of our faith leaders. I think that the church leaders here in Nashville have done a tremendous job of getting the word out to their congregants. And I think that's made a tremendous difference in our effort to fight the virus. And so I applaud them and all that they've done because I think it's made a huge difference in our success. And as Dr. Caldwell said, the fight has only just begun because the virus is going to be with us for quite some time. Until we have a vaccine to give us all some level of immunity to the virus, it's going to be with us. So I think we all need to get comfortable with living with mitigation steps, including wearing a face covering, social distancing, and doing other things to keep us protected. Let me just say that one of the reasons why minority communities are so much more prone to virus spread is that they're not able to practice some of the techniques that we need to do to protect ourselves, including social distancing. If you live in a household that's multi-generational and has a high density, it's going to be almost impossible to do the things that you would normally do in terms of keeping apart from each other. So I think we need to make sure that we have the capacity to have folks who test positive in our communities live apart from their family for some time to keep the rest of the family protected. And I know that the Dr. Caldwell and others are making those kinds of provisions. So once again, I think that the approach being taken in Nashville is progressive, and I think we're doing a great job in trying to stay in front of this. But it's really, really important for people to understand that as the businesses reopen, we all need to make judgments for our own selves as to whether or not we feel safe patronizing those businesses. And that's particularly important if you're older than 65 years old, if you have an underlying condition, or any other thing that would make you vulnerable. My advice is to stay at home as much as possible, continue to do those things that we've talked about, that we learned about over the last few months. And for those of us who live with individuals who are at high risk, we need to be very, very careful that we try to keep them protected because, again, those are vulnerable individuals. And to the extent that we can, we have to keep them from getting infected in the first place because there's no treatment for COVID-19. Remdesivir shows a lot of promise, and that gives us hope that there will be a drug to treat it, and there's no vaccine. So the best strategy we have for saving lives and keeping people from having severe disease is not letting the virus infect them in the first place, and we've all learned how to do that. But it's particularly important that we do those things in the vulnerable populations among us. That includes nursing homes, prisons, minority communities, especially communities that have a lot of immigrants, where can be as many as 4 generations living in the same household. Those are particularly vulnerable, and they need special attention. And I'm very pleased to be working with Dr. Caldwell on the strike teams, as he called them, so that we can respond quickly when we identify clusters to keep them contained. And that's going to be a really important part of moving forward, to not go back, to keep moving forward in our reopening phases. Those strike teams are going to be very important, and we at Meharry are proud to be a part of that. But my message to the city is that I think that we're blessed to have the mayor, Dr. Caldwell, Dr. Jahanger, and others who are using science and data to guide us forward. And that gives me some comfort, having been studying viruses and infectious diseases for such a long time. So thank you to the mayor and for his leadership, and to Sharon Hurt, Councilwoman Hurt, for arranging this conversation, because I think it's very important. And with that, I'd like to turn it over to Dr. Deanne Bullock, who's the Chief Medical Officer for NGH. Dr. Bullock.
Thank you. Can you hear me okay? Thanks for having me. It's great to join you guys this afternoon. Just want to take a few minutes and talk to everyone just a little bit about staying safe, your health, and healthcare currently in our area of COVID within the hospital organization. Like in daily life, many changes are taking place each and every day. There's lots of changing recommendations, lots of changing guidelines. We are making sure that we follow those guidelines, those recommendations within the healthcare organization as well, and stay up to date, following those and keeping our staff and patients aware of those things. While many changes have taken place over the last couple of weeks, as we continue to move forward, we are at full operating capacity within the hospital. All hospital operations have resumed, including our clinics, our surgery services, our inpatient services, and emergency department services. Many people are concerned about the spread of coronavirus. We want to make sure that people are aware that we are safely conducting patient care activities, and that your health and safety is our top priority for our patients, your family members, and our team members each and every day within the organization. We put into place several measures recently and over the last few weeks as things have evolved to make sure that we are protecting our patients and our team members and families as they visit our organization for their health needs. When you visit us, you will realize that we do have one location that you can enter from. There will be screening that happens with each of the patients and visitors coming through, questions, temperature checks, masking for patients, families, all of our employees here at the organization. And employee screenings are done daily as well. We have enhanced some of our visitor guidelines. We are adhering to those fairly strictly, and we are modifying those as guidelines and recommendations change. All of those are posted on our website. They are also posted as you enter the hospital organization and the clinics as well. In terms of COVID care here at the organization, we do have isolation-ready areas. These are within the clinic, they're within the emergency department, and within the patient care areas on the floors. We want to make sure that we protect all patients and that we are doing the appropriate things to keep everybody safe and comfortable in seeking out care currently each and every day within our organization. There are dedicated floors, dedicated units. Within the emergency department itself, if you come in with COVID-type symptoms, obviously we are going to appropriately isolate you until we can evaluate you fully and determine whether or not those are still needed. We are in continuous collaboration with the local, state, and federal authorities, the Metro Department of Public Health, to keep our guidelines and recommendations up to date and patient care activities as well. Our workers are each and every day updated about guidelines, about masking, screening. They are working together to also keep our patients safe, to appropriately place people where they need to go, appropriately place people, guide them to the current locations in which they are supposed to be in. We do maintain social distance, trying to stay as much as we can as far as 6 feet apart. That includes the waiting areas. In terms of your care here and your visits, trying to minimize the time people spend in waiting rooms, spacing appointments, pulling people back to rooms at their visits so that they're not congregating in waiting areas, obviously limiting the amount of visitors within the organization so that we can maintain that area of social distancing. Many of our clinics are also offering telehealth so that you can have the ability, you don't need to have an in-person appointment, you still have the access to your provider, still have the access to get things, have your questions answered without actually having to come into the organization to do all of that. We are also doing pre-screenings prior to your appointment. So when you come in and you have an appointment coming up, to a reminder phone call, we are doing those pre-screens. And if you are symptomatic or showing signs of being potentially doing a different visit type for you, or rerouting your visit to a later time as needed. So you should ask, should you keep your appointment for your patient care at our organization? Absolutely, it is safe to come to the hospital. And we do always offer the option of providing telehealth. Should that be available to you and speaking if that's a viable option, we can always facilitate that. If you do have a scheduled appointment, if it's just a regular non-emergent visit, we can convert that. Either way, we can push it back a little bit. We can facilitate the telehealth. We can do video, audio, we can do telephone visits. And many patients we found have been quite happy with doing that as well, and being able to see their doctor from their home. A little difference in how we deliver care. All of the areas of the hospital are safe to be in. So we are practicing appropriate isolation precautions, screening. So there's nowhere in the organization that you should feel unsafe in terms of seeking their care. I just always want to remind people to continue to follow the guidelines to remain safe, practicing social distancing, at least 6 feet apart from each other, avoiding very crowded places as much as you can, frequent and thorough hand washing, and avoiding touching your face as much as possible, masking appropriately, and then obviously being cognizant that if you're in a higher risk group to do these things even more often and be more cognizant of those things, and seeking to remain healthy throughout this COVID area. One of the things we want to make sure that people aren't doing, while we know that there are plenty of people that are concerned about coming into hospitals and coming into clinic visits, we want to make sure that people continue to actually not ignore those important things that we would normally otherwise seek emergency care for. The emergency departments are still open 24/7. EMS is still running. So those things that you would normally come in for, your chest pains, your shortness of breath, severe pains, difficulty breathing, fevers that won't go away, signs and symptoms of stroke, heart attacks, or any significant trauma, we want to make sure that you don't ignore those signs and symptoms and seek the care that you need to in an adequate time frame. We have noticed kind of over the last couple of weeks, people have been seeking care not as frequently or not as urgently as they normally would, and that can lead to some bad outcomes or some extended periods of recovery times in seeking this care. So just remember that if you ever have chest pain, the shortness of breath, the symptoms of stroke, always seek out that care. We are available by calling our lines, our emergency department, and always call. And then obviously, if there are severe symptoms or any life-threatening conditions, we always want to make sure that you have the ability to call 911 and seek care at the closest and nearest emergency department. Other than that, we will continue to adapt. We will continue to evolve our guidelines, our recommendations. Nashville General Hospital is always here to serve you, the family, and the needs that you may have. And with that, I will hand it off to Dorothy Bennett, who is our Chief Ambulatory Services Officer.
Thank you, Dr. Bullock. A couple of months ago, Nashville General Hospital and Nashville Healthcare Center started partnering with Metro on screening and testing at the Nissan Center in collaboration with Vanderbilt. That assignment finished last Wednesday when Vanderbilt moved out of that and Meharry took that site over. Approximately a month or so ago, Councilwoman Sharon Hertz came to our CEO, Dr. Webb, and said, I have a concern because the care is disparate in our community and the African American community is not being tested as everyone else is, and asked us to start an initiative with her and MDHA to start the testing for their sites. So approximately 2 to 3 weeks ago, we started a partnership with them and Jerry Maynard to begin testing at MDHA. We tested, we've now tested all of the towers in collaboration with Dr. Hall and the National Guard. And we've tested 270 residents, and we also tested 318 of the MDHA employees. Thus far, and I do have all the results back for our testing, we've only had 6 positives, so that's a good thing. We're also planning a retest with MDHA. They've requested that we retest all of their residents and their employees. In approximately 3 weeks, we'll go back in and do retesting for them. But thus far, we've had, I feel, very good results with just having the 6 positives. And those were all residents. There were no employees that tested positive. So you can feel comfortable that the MDHA employees out there are solid as far as COVID goes. And other than that, that's all I have. Thank you, Councilwoman Sharon Hurt. And I believe Dr. is going to start talking now.
Yes. Good afternoon, everyone, to my distinguished panelists and to all who are listening. Thanks to the Office of Mayor John Cooper, the Minority Caucus of Metro Council and to Councilwoman Sharon Hurt for inviting me to this panel. I'll be discussing safety from a neighborhood perspective. As a primary care physician, I am in the trenches when it comes to face-to-face visits and frontline care. In the months of April to early May, I had the opportunity to roll up my sleeves and further extend my outreach in the healthcare community by participating as a community partner and leading COVID-19 screening initiatives with special focus in our senior African American community of Nashville. I was partnered with NDHA Properties, Capstone Healthcare, the Maynard Group, Councilwoman Hurt, nurse volunteers from Metro General Hospital, and faculty and student volunteers from Meharry Medical College. Together, we provided screening and testing to hundreds of MDHA residents to this vulnerable population of our society. It was definitely a rewarding experience to educate and increase health awareness on safety and protection from COVID-19. The population that we catered to had limited means and did not have easy access to the free COVID-19 testing sites. It meant the world to them to have healthcare professionals, especially ones who look like them, to come into their neighborhoods. I was glad to be a part of an effort to increase access to healthcare to our African American and minority senior community. We educated them on the symptoms of COVID-19 and monitoring for symptoms. We educated on social distancing, limiting contact with others, limiting use of public transportation, washing hands, and using masks if going out into the public. The results of our screening efforts were very rewarding. Many of the residents were already heeding to this advice. However, there were some that had to be further encouraged to adhere and heed to these CDC guidelines. The screening efforts definitely made a difference and saved lives. I leave you with this one impactful story. Thankfully, 99% of the tests that I conducted were negative from the screening events I led. We screened, when I was a part of it, I screened about 221 residents, and we did about 167 tests. 99% of those tests were negative, but we did have one positive test, and this was in a gentleman who was over the age of 80. He had multiple chronic health conditions, and he was on dialysis. He actually had no typical symptoms for COVID-19, just 1 to 2 days of mild diarrhea. Because of the symptoms, he actually skipped his dialysis session, and when it was discovered that he had the positive test result for COVID-19, he bypassed the dialysis center and went to the hospital where he could have his dialysis done in an isolated area for people with COVID-19. Had he not known his status, he could have exposed multiple vulnerable patients like himself to COVID-19. But due to our screening efforts with NDHA and Metro General and the others that have volunteered, the volunteers from Meharry Medical College, by him knowing his status, he protected and spared not only himself, but many other patients from exposure to COVID-19. So the education, the awareness, encouraging in others to adhere to the CDC guidelines and precautions for COVID-19 definitely makes a difference and saves lives. So that's what I wanted to share as far as my experience. Thanks again for allowing me to be a part of this panel. And with that, I'm going to turn it over to, I believe, Representative Harold Love.
All right, good afternoon. Can everyone hear me?
Yes.
All right. Thank you. Sorry about that. I want to thank everyone for the presentations and want to give a brief overview of federal and state funds as we stand today, which I think will have an impact upon our outreach to reduce these issues in the minority community. For those who are not aware, what we have received from the federal government will amount to about $2.3 billion to address the COVID-19 coronavirus pandemic that we're facing. And that is part of the $150 billion CARES Act money that was sent specifically to state governments and to local counties and cities. The way that dollar amount came out to be was that every state was to receive at least $1.25 billion, and then the counties and cities in that state would also increase that amount based on their population. If you had population above 500,000 people, then the state share and the city share would be split, 45% to the city and 55% to the state. So with Nashville, Tennessee having a population of over 500,000 people, Nashville received directly $121 million, and the state received the other 55% of that amount of money, which amounts to about $143 million. So then the question remains, how should the state spend that money that they received across the entire state when it comes to issues of addressing COVID-19 coronavirus? The task force that I've been put on, along with Senator Agberry and Representative Pat Marsh and Senator Bo Watson, the two speakers of the House and the Senate, the governor's office, is dealing with just that issue right now. One of the major problems we found was that unemployment was a tremendous barrier to people in the COVID-19 coronavirus pandemic, because you have a lot of self-employed persons who are unable to file because the system was not set up to address persons who are self-employed. So as a result, as they were going in and filing, they were not even able to get the opportunity to get a check. And that's when the federal government piece of $600 a week coming down still didn't help them, because they could not get into the system. So those changes have been made now and allowing persons to apply for unemployment benefits and to receive that going forward. There's also a policy in place that allows them to be able to get more unemployment once their unemployment is exhausted. So one might ask, well, then, how does all that deal with and affect minority communities and the money received for COVID-19? There's also money coming down for our HBCUs. Every school receives some money as a higher education institution, but then there was also money set aside for our HBCUs and minority-serving institutions to help them deal with costs they did not have planned for because of COVID-19. This money was set aside to help them with students preparing for the fall semester with online courses, but also to help students with financial aid going back into school. There's also $26 million allocated to our metropolitan public school system. Specifically, this money is designed to help students prepare for the possibility of online courses and online work being distributed or sent out that way. This is important for us to note, because we know that in the minority community, oftentimes we have a digital divide. Persons don't have access to the internet. They do not have the appropriate hardware to access the internet. And this is important for us to keep in mind, because if we're talking about reducing health disparities, we're talking about improving the health outcomes of minority community, we must add education into the equation. Because if you cannot get the proper education to pursue careers in medicine, if you don't get the proper education to pursue careers in finance, or any career you want to, then you have this stigma placed upon you. You also have anxiety when you go to school, and you also have those issues. And so to make sure our students get the proper education, it's important to make sure they have the devices that can access internet and the content. It's also important to note that there's money set aside in the CARES Act and money that Metro Schools has received to specifically undergird free lunch programs and summer food programs. We know that most of our students, suffer from not having food security, and oftentimes the school is the only place where they're actually able to get a meal. And so this is one of the issues we have to face also, is how do we make sure we get food to our students and make sure that those students are taken care of. And so there's money available. There's also money available for child care and for daycare facilities. DHS. There's about $81 million that DHS has received directly to ensure that after-school and daycare programs are undergirded. This is important because if persons are going back to work, they need to know that they have safe environments to send their children where they can be taken care of and cared for while they are at work. And so there's an abundance of dollars that are coming down. Our task is to make sure that with the minority community, we don't get left out of the distribution of these dollars, to make sure that as persons are trying to go back to work, as persons are trying to improve their health, that the money is equally divided in an equitable manner. So federal dollars coming down, state dollars that are there, and city dollars are what we are tasked to look at and distribute and make sure that we have ample resources for this. There are also dollars available for rental assistance. THDA has received $18 million that can provide rental assistance to persons. This is important also coming out of our tornado, that we understand that our minority communities can also be undergirded with rental assistance, so they're not under the stress of having to pay rent while they're out of work, not having to worry about those issues, which is going to bring on more anxiety and increase their health disparities. Those are my comments. If there's any questions, I can certainly refer to documents that I have to list out specific dollars that we've received.
All right, thank you very much, Representative Love. Thank you very much, Representative Love. We have a few questions that have been submitted, and feel free to add to those in the chat box on the screen, and I will send the questions to the different panelists. First question is for Dr. Caldwell. The question is, what kind of data do we have now? And if not, are we planning to collect information on people who had COVID-19 with symptoms versus those who did not display symptoms before being diagnosed?
Yeah, well, the data that we are collecting right now is just based upon positive lab results from these viral tests that we're getting to identify cases. Our epidemiological case investigation team, that's their number one priority, is to reach out to and communicate with people who have had a positive test to try to identify, have they had symptoms or had they not had symptoms. So we're collecting a little bit of that information. That's less important to us than trying to identify where we think they may have contacted it. Is there anyone else that they know that has been positive? Who do they live with? Who else do we have to do a ring around that particular case to identify who else should be most immediately requested to get a test? So this particular question, I think, is something that a lot of researchers and scientists are very interested in. It also leads to the thought about antibodies and how people may have antibodies, whether they're asymptomatic or symptomatic. Right now, the antibody test is something I find as a scientific curiosity. We're probably not going to get enough information about antibodies for at least 6 months or antibody tests to be able to help us. Right now, antibodies are not going to help us stay safe or knowing about them. It's not going to help us on our phases for reopening. Everything that we're doing right now, we need to do more of it. And we're going to learn more about this. But everything that we learn is telling us that we must assume that anyone at any time is carrying the COVID, regardless of whether they feel symptomatic or not. And also, anyone who we encounter who seems fine may be a risk to us. So if I see someone that I am encountering and I see they're not wearing a mask, I wish they would be wearing a mask. And similarly, if you ever see me not wearing a mask, please say, Dr. Caldwell, where's your mask? Because I want to show you respect, and this is just one small way I can do that. So, thank you.
Dr. Caldwell, this is a perfect follow-up
Okay.
for you. The refusal of many people to wear masks in public spaces jeopardizes my health, and it imposes little, if any, restrictions on the person who should be wearing it. What can be done to emphasize the importance of everyone to wear masks in enclosed spaces?
In enclosed space. Well, we are learning as we go. We cannot do this without the community's support. We are trying to teach the community about the seriousness of this virus and disease. In the last few weeks, I myself have worked with the mayor on a continual reevaluation of how to introduce these changes to our community in a way that they'll be understood and accepted. For example, Public Health Order 4, initially, I wanted to mandate and require that anytime you entered a building that was a public facility, that there was a sign that said, please follow CDC guidelines and wear a face mask or facial covering in our facility to protect our employees and to protect each other. So we required the sign, and at the time we were debating, should we require face masks? And then once we decided to go from the Safer at Home order to phase 1, the mayor and Dr. Jahangir and I said, well, we want to at least now require employees to wear the face mask. Once again, to move us more to this culture, social acceptance of seeing and getting used to seeing people with face masks. Because we believe if you go into a business, you should expect and have the right to know that all those employees are doing everything they can to protect you from them. Similarly, because we're mandating the sign, we're encouraging everyone in the public to wear a facial covering in a building. Some facilities, businesses are actually requiring it themselves. You cannot enter this space without wearing a facial covering. We want to give a little bit of flexibility for businesses to manage that with their customers at this time. I do know I've seen signs and I've even heard verbal comments where people will say, thank you for protecting us by you wearing a facial covering. An employee might be giving me a coffee and saying, thank you so much for wearing that facial covering. It means a lot to me. So we need to continue to express appreciation for those who are doing it and to make sure that our public servants and others who are walking around the community, we get used to seeing people with face masks. It's just going to have to continue moving forward on this. I need your help, and I think we'll get there. Thank you.
Thank you, Dr. Caldwell. Next question is for Council Member Hurt, please. In light of the disparity of COVID deaths in the minority community, what is being done locally to minimize the impact and address other related disparities, including lack of adequate health care, housing, food security, and internet access?
Thank you so very much for that question. And let me first say that this is an effort that on behalf of the Minority Caucus. I just happen to be the proud chair of the Minority Caucus, but all of its members are very, very concerned about the disparity of the minority communities, knowing that health disparities are disproportionately affected negatively. So everyone is doing the very best that they can. I'm so happy that you asked that question about that. That's part of the screenings that's being done, not only for the COVID-19, but there's also blood pressures. Different questions are being asked to make sure that people are healthy or otherwise need some kind of help. And I have specifically talked to the mayor, and I know that he has agreed in some of the screening that's being done at MDHA. And we wanted to start there because they are vulnerable populations, because they're dense populations, a lot of people are there, and they don't have access to health care. So when they can't get to the health care facility, we take the facility to them. And that's one of the things that Metro General is doing, is going to those public housing facilities and screening to make sure that they address those issues. That's something that Dr. Hall referred to in her comments. And she and Dr. Bullock or Ms. Bennett can continue to add to what it is that I'm saying. But I know that Metro General Hospital also created a smaller version which is like a private doctor's office on Charlotte Avenue for people to be able to go in and out on their lunch hours throughout the day when it's most convenient for them. And in order to address those issues and screening, you can run in and you run out. Those things are easily accessible at that Charlotte location. And I know I sound like I am pushing Metro General Hospital because I am. It is Metro General. It is the community hospital. And prior to that, it was Hubbard Hospital, and I had all 3 of my children there. So I know it, and I'm not just saying it. But I do encourage you to do that. And like the mask question, you know, my mama told me that it's better to be safe than sorry. And this disease can kill. And sometimes people need to hear it just plainly like that. It can kill. And we don't want to be a murderer by killing others, and we definitely don't want to be a victim of someone and get murdered by not wearing our mask. In fact, y'all, they told me to take this mask off while I'm here now, but I almost kept it on because I don't want to die. Not right now anyway. And I encourage you not to. And I understand that our death is a destination, but we also know, oh yeah, well, my gloves too. We know death is a destination, but we also know that we can run out in the middle of the street and get hit by a car and die, or a bus or truck, but we don't do that. So we've got to use common sense when it comes to things like this. I've got relatives who have recovered from the coronavirus. I have friends who actually have it right now. So I personally implore you, beg of you to wear your mask, stay safe, and make sure that you keep others safe. Thank you.
Another question for Dr. Caldwell, please. It appears our best efforts have been due to proximity to testing. In other words, having centers near Meharry and going to nursing homes. Is there a plan to replicate this in Southeast Nashville?
We're looking for partners. Give us some of your ideas. Not only do we need your ideas, and we're ready to partner with you, but we are already partnering with Siloam Community Health Center, with the community outreach workers. We're trying to expand testing at all existing community health centers as much as they possibly can. I spoke with the Neighborhood Community Health Center earlier today. The CEO, Brian Hale, he's doing extended outreach as they can with testing with the homeless population. So we're looking for partners. We want to work with you. We are going to, in addition to that, seek you out at the same time. And one of the specifics, deliverables that we're looking for with our partnership with Meharry is these strike force teams that not only will go into these other locations like the jails or a particular nursing home that we may need quickly, or a homeless shelter, but it will also be to do some more mobile community outreach. Now, these may not be permanent the way we have the other 3 centers set up, so we'll really have to partner with those in the community to say they'll be testing on this day at this time, similar to how we did it with Metro Housing. So we have a lot more work to do. I need your help, we need your help, and we will try to support each other by making sure we have access to the swabs, the testing resources, the lab capacity, make sure it's free, get the staffing there, the security. We want to test not only in Southeast, of course. I think if you take one step back, the fact that there are so many positive tests in Southeast show that we are doing a lot of testing in Southeast. Now, I don't like to see the positive results, but look at it in a different way. Look at it and saying, wow, we're really exposing that that's where the virus is. Of course, that means we should still do more enhanced testing there because we're probably missing it to some extent there, but I don't think as much. What also concerns me is where else in the county where we don't see any red dots right now that we should be doing testing. And I want you to help me think of those as well. One of the items that I want to inform you about specifically when we're talking about face masks is tomorrow, Friday, May 22nd, and Saturday, May 23rd, there's going to be a continued distribution of the face masks at our four community health centers from 9 a.m. to 1 p.m. That's the Hartman Park Community Center, the Bellevue Regional Center, the Madison Community Center, and Smith Springs Community Center. Not only will we be handing out masks, but we'll be handing out informational brochures, as well as these signs that I told you about that say, please wear a face mask in our establishment or in our home. And please let me remind you of our Nashville-Davidson County hotline number. We're there for you every day, 7 a.m. to 7 p.m. That number is 615-862-7777. 615-862-7777. We have medical staff standing by to answer any of your questions about COVID or anything else that we can help you with from the Department of Health. Thank you.
Dr. Caldwell, another question for you. 2 days ago, 230 new cases were confirmed in 24 hours, and today it's down to 50 new cases. How do we account for the discrepancy?
Very simply, it's when the lab reports it to us. Even though there may have been 230 cases reported to us on one day and 50 on another day, when we look at those cases, the day of when the testing was may be distributed among a few different days. So when you hear, oh, there are 230 new tests reported, it's not that they just happened on that day. It was just that we got the result that day, and the testing may have been over a series of days. We have to put that in the context of how many negative tests there were that day as well. And what we have been really pleased to see recently, a downward trend in the total number of cases overall, a positive over total number of cases. This is good news. It shows that we are expanding our testing capacity. We're testing more. Probably one of the top 10 communities in the United States are doing aggressive testing of our community, and we're seeing that positivity rate of where we're testing slowly creeping down. Not going down fast enough. I am concerned as we move into phase 1 and phase 2 that it only takes one event for somebody to really spread it, and then within a week we might be in a place that we don't want to be. That's why we're limiting the number of gatherings right now to only 25. 25 is the limit of gatherings. I still am concerned about that number myself, but we are trying to slowly move us into reopening, and if we can get this right, then we can get to the next phase. So I'm counting on you. I need your help.
Another one for you, Dr. Caldwell. Has there been a concerted effort to do contact tracing, and could you describe what contact tracing is?
What is contact tracing? Well, it starts with us receiving a positive test. And let me also say that I expect our medical providers, if you have a suspect case where you think, let's say, there is somebody who is exhibiting symptoms and you've tested them, even before the test comes back, report it to us. Let our Department of Health know, because we need you to help us. The requirement is that any positive test from a lab must get reported to us, but medical providers are required to report not just the confirmed cases, but suspect cases as well. So once we get that positive test or even a suspect case, our team now, over 100 contact epidemiological tracers, will reach out to talk to or some way communicate with this particular individual. We will find out where they live, who they've been around, where they work. And since most people have been at the Safer at Home order, most people don't have too many contacts. What we are seeing, though, is some of the essential workforce that some people do still have a number of contacts. Do me this favor. At this point, make sure you plan right now to know that someone you know will have COVID. Do that because it will happen. And when it happens, I'm going to need your help because you're going to need to be able to help that person figure out what's their diary, what have they been doing for the last few days, who have they been around, where have they gone. That will help our contact tracers tremendously, because then we'll be most quickly able to find those other people to say, hey, you've been in touch, you've been in contact, we believe, with someone who's had COVID. We suggest that regardless of whether you have symptoms, that you go right away to one of our testing sites, get a free test. You should be back within 24 or 48 hours, or go to a testing place of your preference. And that is just a small sample of what contact tracing is about. Not only do we communicate with them on the very first day, we communicate with them every single day for up to 10 to 14 days, depending on whether they were a positive case or just a secondary case. For example, if somebody's positive and they live with 3 other people, we will also be asking those 3 other people to isolate and quarantine themselves, because they are at most risk of possibly developing contact tracing. So we're not only going to be talking to the one positive person, we're going to be talking to those secondary potential contacts every day until we find out whether they are going to turn positive or not. So I hope that provides you just a little insight into what contact tracing is.
Another question for you, Dr. Caldwell. How long are test results currently taking?
Well, there are dozens and dozens of labs. The ones that people use most readily in Nashville-Davidson County are the Vanderbilt Lab, or our assessment centers, or the Tennessee State Department of Health. I could tell you that our assessment centers are using a company called AEL, and we're getting results pretty much within 48 hours. There are some labs that could take up to 7 days, although. And I think we're starting to see streaming of tests. There are certain, I think, community centers that are using these new very quick tests that you can get results in 15 minutes. And we're still watching closely about how valid these tests are regarding false negatives. So we are learning as we go. My main recommendation to you right now is, if you have a choice, go to our community assessment sites. They're open every day, Monday through Friday from 9 to 3. Often there's no wait. It's free, and we provide a great service to you. So please try to get those. If you can't, let us know. Call that hotline at 615-862-7777, and we'll work with you to find out what your special circumstances are so you can get tested, or a loved one can be tested. Or if you're an employee and if you have a question about your workspace, or if you are an employer and you have concerns about your safety of your employees, we're here for you to answer your questions.
Dr. Caldwell, you're popular. There's another one for you. If someone were to have a test today, would it be disclosed to law enforcement at the time of testing?
Yeah. Well, no, not at the time of testing. However, if it is a positive test, we do share that with our public health partners. Our public health partners are the Office of Emergency Management, Ambulance, Fire, and police. And there are 2 ways that this data is shared. One is in a CAD system, so that if you were to call for help and the ambulance or a police officer would dispatch to respond to an emergency at a residence where we know there was a positive case, that would come up so that the responding ambulance or fire or law enforcement official would get that sense that they should take extra special precautions at that particular home. Now, it's sort of easy to say, well, they should always assume everyone has COVID, and that's what we're trying to do. But we also know that if people know there's absolutely a recent history of COVID, people are just more naturally going to take extra special precautions. They'll be able to assure that if they need to transport anybody from that home to either the hospital or to law enforcement, booking or jail, that right away we'll be able to isolate and quarantine and protect that patient, that person from others. There's another system that works in tandem with this, where an actual name of the person gets placed into a database so that if any one of our emergency responders does encounter somebody outside of the home environment but somewhere in the community. Now, this is all the more important now because we're opening up the community and people are not just staying at home, that the emergency responder, law enforcement individual can very readily know this is somebody that's recently tested for COVID and they can take the appropriate precautions. Now, that information of somebody's actual name, that expires, and we're working to amend that expiration period to probably be only about 7 days or so. So it's not like this is something that's going to stay on for any longer than it has to. And we'll be providing more details soon, because I know the mayor's office and a team have been recently reevaluating this to look at the options and the benefits. Let me say one more thing about this. If you look at the outbreaks in jails around the country, there have been explosions of cases in jails. We've been lucky here in Nashville-Davidson County that we've only had about 21 cases in inmates as well as the law enforcement officers, and most of those have recovered. There are a few other people that are still under maybe contact isolation or quarantine, but for a community here with a jail population of over 1,000 between inmates and officers, we've done an excellent job of identifying, containing, and controlling this virus, and I really believe we've saved lives through this process. And we want everyone to know that we're doing everything we can to extinguish this virus as quickly as we can.
Thank you, Dr. Caldwell. Another question for you. The question is everyone who tests positive subject to quarantine order?
Everyone who tests positive will get a signed letter from me saying that you are required to isolate and quarantine. And that's easy to do if you have your own home. We do our best to assure that you're complying with that. Now, of course, with the homeless population, it's more difficult to do because they have really nowhere to go. Some are isolating and quarantining in their own encampments, and then some have to be quarantined at a facility that we label as quarantine, which is an area at the homeless shelter population. So everybody has been cooperative, except for one individual who chose not to follow our direction. And so I'm happy to say there's only been one case of that where we've had to enforce that order. So,
thank you, Dr.
Councilmember Hurt.
Thank you, Dr. Caldwell, so very much for that informative session. This has been great. I want to thank the mayor, thank the Minority Caucus, want to thank the excellent guests of panelists that we had. You all were awesome. I know that we all are a little bit more knowledgeable about COVID-19 and its effect in the minority community. I wish you all well, ask you to stay safe, wear your mask, wash your hands, and God bless. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.net.